I'm 30 years old and I get dental cleanings once a year. I regularly rinse my mouth and do everything I can do to maintain good oral hygiene, but I still often experience bad breath, which affects my confidence when meeting people. Could you guide me on what else I can do to get rid of it?
Man, bad breath. Multiple reasons, right? It could be a variety of reasons you're going to have bad breath. Either you have dental plaque, or you have gum disease, or you have dry mouth, or you're using a mouthwash with alcohol, makes your mouth dry, or you're using some medications that making your mouth dry, or you're drinking alcohol that makes your mouth dry, or you could be having some kind of like a gastrointestinal issues, and that is causing the bad breath. So there are multiple reasons to why you could be getting the bad breath. So we say, we say in medicine, or we say in our life, a process of elimination, right? If you have gum disease, again going back to what we talked about earlier, common things are common. So when you have gum disease, the first thing that I'm going to say is, hey, treat your gum disease, which is an easy fix. Then we will talk about, okay, hey, do you have dry mouth? Yes, we'll treat your dry mouth. And if you treat your gum disease and your dry mouth, and hey, could any type of habits, for example, smoking or using a certain type of spicy food, or drinking alcohol, so then fix the habit. Then last comes to what we call it as the digestive issues. So either we work with you, or we work with a physician to help you take care of the comprehensive approach to the problem, right?
Yeah, so it's kind of like a process of elimination almost. Just
Mm-hmm.
go down the list and
Go down the list,
yeah.
and then go Nike.
Go Nike, just do it.
Just do it, right?
Just
Yeah.
do it.